The Honourable Leader of the New Democratic Party.
My question is for the Premier. A series of Auditors General over a succession of decades have been reviewing and looking at this question of P3 projects in Nova Scotia. In '97, the Auditor General issued a report critical of the P3 arrangement about the 39 schools. In '98, the AG criticised the government's failure to effectively compare costs of the schools between P3s or the public sector. In 2010, the Auditor General issued a report critical of the government's failure to exercise a duty of care about the P3 schools. Mr. Speaker, why, in choosing now a mode of hospital development, has the Premier chosen to ignore 21 years of work from the Auditors General of Nova Scotia?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. If you go back and look at those continuing reports, Auditor Generals have made recommendations on how we continue to improve P3 models. There are very different models being used in different parts of the country, Mr. Speaker. As I said to him earlier, we believe this is the appropriate path forward when it comes to the redevelopment of the QE2 here in the peninsula, Mr. Speaker, ensuring that we have a modern healthcare system that reflects the needs of today and the realities of 50 years from now. We're going to continue down this path of working with our private sector to ensure that that infrastructure is in place. I also want to say to the honourable member, I was pleased to be able to support his government's decision on the P3 model they chose when it came to the Nova Centre. I want to continue to congratulate his party for adopting the P3 model, and we're going to continue to make sure that we provide those infrastructure for our citizens.
The Honourable Leader of the New Democratic Party.
Evidence still counts, Mr. Speaker, for something. The New Brunswick Auditor General reviewed the decision of the government in that province to build 2 P3 schools, and he found that the government spent $1.7 million more than they would have with a normal building method. And the Ontario Auditor General reported that P3 projects cost the province $8 billion more than if the projects had been built by that province. In BC, the Auditor General found the government was paying nearly twice as much for borrowing through P3s as it would have had it borrowed the money itself. Mr. Speaker, why should the public of Nova Scotia believe the government's single lone secret Deloitte report when there is a whole country full of Auditors General who have come to the opposite conclusion?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the honourable member for the question. We're continuing to look forward as we continue to roll out, Mr. Speaker, our P3 option to deliver primary health care here in the capital region, Mr. Speaker, that will provide services to citizens across our province. We believe this is the appropriate model. We will continue to do the due diligence we've had, Mr. Speaker, since I made this announcement in 2016, following through for the next 12 months to ensure that we have a contract, Mr. Speaker, with a developer that is tight, one that will deliver on what the commitments that our healthcare providers are telling us are required to ensure that we can deliver that. Mr. Speaker, we will expect our contractor to deliver this project on time and on budget, Mr. Speaker. The honourable member, when he's referring to what's happening in the Canadian province, is ignoring the fact that in this very own province, Mr. Speaker, when a former government announced a hospital in Truro for $90-some million, it was more than double by the time it went through, Mr. Speaker. The Auditor General continued to have a comment about those, continue to say that, Mr. Speaker. We're going to continue to make sure that when we put together infrastructure, Mr. Speaker, it is exactly what we want. It's exactly what Nova Scotians expect. It's exactly, Mr. Speaker, what the healthcare providers want to work in, and we're going to continue to do so with our partners.